I think NOVO Health is a wonderful organization that has brought something that's very much lacking in today's medical community, and that is transparency in healthcare. So I'm always looking out for the best interest of each and every one of my clients to say, all right, well, what else is out there? How can we help drive down cost? How can we help teach the employees to be good consumers in healthcare today? Because the reality is that is a need that we all have to work together on. The broker, the upper management in the organization, and each and every employee ultimately have a responsibility to make good consumer-driven choices in healthcare today. If not, that's where we're going to see premium increases continue to go up and up and up. When we take ownership and responsibility for the choices that we're making, that's where we can create a better fixed cost advantage for the employer and for the employee. So I love partnering with NOVO Health simply because we know that it's going to be quality care. I mean, these are all absolute centers of excellence. And so we're not sending any of these employees to a budget doctor. We're sending them to world-class physicians who are taking excellent care of them from start to finish, and at the same time, we're saving the plan money. So it's a win across the board. It was a couple of years ago when we first started bringing NOVO Health to Omni's attention. And at the time, we hadn't been doing a whole lot of consumerism education, but we had a meeting with ownership and upper management. We got everybody on board and said, hey, listen, if you guys want to gain control of your healthcare spend, we need to start teaching your people how to use it. Because the reality is there's a lot of tools that exist out there. People just don't know that they're there. So let's tell them what's out there. And it really started out by saying, you know, guys, let me just teach you how healthcare works, right? Money doesn't grow on trees and healthcare isn't free. It's got to come from somewhere. So let's figure out how we can work together and have them better understand how healthcare works, what's going into the renewal, how the choices that they make are going to impact not only their plan design, but how much they're paying for health insurance. And they care. Nobody wants their health insurance premiums to go up, so they listen because we were there teaching them how they can save money every day when they consume healthcare and how it's going to help create a longer-term plan of protecting their plan design and their premiums. We worked really hard then to build out a plan, piggybacking on safety meetings where we had every single employee there. We had a captive audience and we were teaching them and empowering them in ways that they could actually make a difference in the organization that they work for. So it was really cool to see the entire ownership and leadership team come together at Omni Glass and Paint to say, yes, we agree, this is the right thing to do. And it was amazing. We were actually able to hold their rates at renewal last year because of a lot of these initiatives that we were putting forth. And the employees felt it, and they knew they were a part of something bigger. And for them, you know, that was a way that they could see, you know, taking ownership of their healthcare and of their spend and how it positively impacted not just them, but the organization as well.